Good afternoon, everyone. This is Heather Gavris, and welcome to today's webinar. We're really excited that you're being able to carve out some of your time and be able to join us over the next 45 minutes to an hour. My name is Heather Gavris, and I serve as the National Program Lead for the Healthy for Life Facilitator Network, and will be the facilitator and moderator for today's webinar. And the objective for today's webinar are learning about the results of a pilot that was done by the University of Kentucky Human Development Institute as they were integrating and developing some new resources, which you'll learn about as well in today's webinar. Certainly, we hope that you're able to identify how you might use those resources in your own community going forward. We are recording today's webinar. The recording as well as the presentation will be made available on the Healthy for Life Facilitator Hub within the next couple of weeks. So certainly check back in if you are looking for that. We're also going to use the Q&A function within Zoom. You're probably well aware it's located on the bottom of the screen. So if you want to log in your questions there, certainly we will have some time towards the end of our presentation to answer and address those questions. If for whatever reason you choose to log your questions in the chat function, that'll work as well. As I mentioned, this is an opportunity to really hear about some of the work that was mentioned and debuted back in October. And so I'm super excited to have our two guest speakers join us again. So Lindsay Mullis and Austin Nugent, they're both with the University of Kentucky Human Development Institute. I am just going to provide some quick bios on our speakers just so that you're aware of their background. Lindsay is the Inclusive Health and Wellness Director for the Human Development Institute at the University of Kentucky, and certainly partners with a number of different organizations across the state, including the Kentucky Division of Developmental and Intellectual Disabilities, as well as the Centers for Disease Control, their Disability and Health division to promote healthy lifestyles for people with disabilities. She has her bachelor's in psychology as well as exercise science, and has a master's as well in health promotion and a certificate in development disabilities. She's also in the process of pursuing her PhD in health education sciences. She is currently working and has worked with Health Matters, which is based out of the University of Illinois at Chicago, to become an advanced certified instructor for the Health Matters program. She's also a certified health promotion clinical director for the Special Olympics and serves on the Special Olympics Inclusive Health Advisory Board. Also joining are Austin Nugent. Austin is the Disability and Health Program Coordinator for the Human Development Institute at the University of Kentucky. She has her bachelor's in sociology as well as disability studies at the University of California at Los Angeles. She spent over the last 10 years working in a variety of roles in the field of disabilities, really providing support for professionals, youth, and communities, and certainly is an advocate herself. She has a vast experience in implementing and training professionals and families on inclusive strategies as well as universal design. She is really passionate about supporting equitable, programmatic, policy, systematic, and environmental change that really support this intersection between among our diverse experiences. So I'm certainly super excited to have both of us join our webinar today. Just to get us started, I do have just maybe a fun poll. I'm sure we all have had polls as a part of a way of just engaging, but this is just maybe a fun poll just in the spirit of spring. So what is your favorite thing about spring? Preparing the garden, the fresh blooms, enjoying the outdoors, spring cleaning, or absolutely nothing? I have allergies. So we'll just give it another couple seconds here for people to chime in. Great, no allergies. Nobody wants to spring clean. Great. So obviously we have a very active group. They love the outdoors. So great. I'll have to fess up. You know, I do myself like spring cleaning. It's a way that I can sort of, you know, kind of reclaim my home. Well, thank you for entertaining this real quick poll. For those of you who are just joining for the first time and are learning about Healthy for Life, I'm just going to provide a very brief overview of the Healthy for Life community program. You may not be aware, but back in 2015, the American Heart Association and the Aramark came together with really this bold commitment of improving the health of all Americans, particularly by empowering people to make healthy food, nutrition, and lifestyle choices. And certainly over the course of our relationship, we have done this through a multi-sector approach, everything from menu commitments to looking at innovative ways of engaging consumers, as well as the community, as well as just looking at employee health and well-being. As part of our relationship, we have co-developed a community program which really aimed at changing that relationship with food and nutrition, particularly by inspiring individuals and families to make those healthy food choices an everyday part of their lives. And we do this through a multi-pronged approach. So certainly, first and foremost, it's engaging and really empowering communities, particularly those communities that are under-resourced and those in working with people who have the greatest need. And then really working with community-based organizations such as yourself to offer this science-based and impactful programs with that, kind of ultimate goal of equipping individuals with the new skills and confidence to prepare healthy meals at home for themselves and their family. Over the course of our work collectively, we have really built out a very comprehensive suite of resources, and it's really, including an extensive curriculum of, both educational as well as engagement experiences to help individuals discover, choose, and prepare healthy foods. And we like to think of them as facilitated food discovery experiences so that they are hands-on. They certainly involve some component of, a cooking class or recipe tastings, grocery store tours, all with that intent of building someone's food literacy to improve the health and well-being of their families. It is based on the American Heart Association science, as well as we continue to evaluate the impact of the community nutrition program. And that evaluation also leads itself to continue to inform the development of additional resources. I'm proud to share that the Healthy for Life community program is also part of the SNAP Ed Policy System Environmental Toolkit, as well as it is a part of the SNAP Education Library. So I know that that was very, very brief. Certainly, if this is your first webinar and participating with Healthy for Life and you want additional information and guidance as it regard to the implementation, certainly there will be an opportunity just to connect with me directly. But for the purposes of today's webinar, I really would love to turn it over to our team at the University of Kentucky Human Development Institute just to talk about their experience in developing some great new resources we're excited to share.
Thank you so much, Heather. We're really excited to be here. I can definitely speak for Austin and myself that this is the summit of some wonderful collaboration with Aramark and American Heart Association, and we're really excited to be able to share with you what we've brought together today for you to implement in your communities across the nation. So we're really, really excited to share that with you all. Just a little background about who we are at the Kentucky Inclusive Health Cooperative. We do function as Kentucky's state disability and health program through the CDC, but really our mission is much broader than just our state of Commonwealth. We work to create resources and build partnerships that provide education and empowerment to individuals with disabilities as our target population. But we do that through focusing on universal design, which encompasses including everybody and inclusive and accessibility for all audiences, which is the lens that we brought to the Healthy for Life program.
So just some quick stats to get you thinking is that it's important to point out that 1 in 4 adults in the United States, or about 26% of adults in the United States, experience some type of disability. And within that, you can tell by this bar graph that in each category of different health disparities, people with disabilities experience health disparities at a much higher rate than individuals who do not have disabilities. And so, like Lindsay and Heather pointed out, the resources and information we're going to share today was a collaborative effort between our Kentucky Inclusive Health Collaborative at the University of Kentucky's Human Development Institute in collaboration with both Aramark and the American Heart Association. And everything we did was centered around the concepts of universal design. And so universal design as the idea or the design of products and environments to be usable by all people to the greatest extent possible without the need for adaptation or specialized design. It's also considered a process that enables and empowers a diverse population by improving human performance, health and wellness, and social participation. So I'm thinking about that. Universal design, in a nutshell, is thinking about all the various ways that people interact with the world or curriculum, environments, resources from the very start of the design process through implementation. And we really like this graphic because we think it does such a great job of depicting what is universal design. So we have this comic, and there is an individual in a wheelchair that is asking the man shoveling the snow, can you please shovel the ramp? And the man shoveling the snow says, all those other kids are waiting to use the stairs. When I get through shoveling them off, then I will clear the ramp for you. And the man the individual in the wheelchair says, but if you shovel the ramp, we can all get in. So that is again, what we think beautifully depicts what universal design is. So thinking about, rather than having separate designs, let's create something that everybody can access and engage with.
And this is important for us in our scope in thinking to support people with disabilities that experience those unfortunate health outcomes that Austin shared, but also too recognizing that because we're focusing on universal design, there is the broader application of really benefiting everybody. When we do our universal design training, we talk about how all of us have different learning styles, even depending on the environment or the content that's being provided. So that is why it's important for us to share with you all today that as a part of what the resources that we created in collaboration with American Heart Association and Aramark, we included a diverse review panel that included people with various disabilities, both physical, cognitive, mental, and all of the other ways that we describe disability, but also with professionals through the health fields with different types of backgrounds in dietetics or nutrition, and as well as exercise and physical health. And then disability was included in that. And then also we had professionals that were English as second language educators, and their participants and learners also reviewed this curriculum. So we wanted to make sure that we were also including literacy considerations and cultural considerations when we were creating the content for these resources. And we're excited to share with you some supplemental handouts developed by our team, but we want to give a special shout out to Carrie Jones, who is our graphic media producer as a part of our team, because she takes the content knowledge and the things that we talk about and how we want to make it look so wonderful and pretty and accessible, and she makes it happen. And so we're grateful to have her be a part of our team. The first one here is our weekly meal plan. And so as you can see, these handouts, if you're familiar with the Healthy for Life curriculum, are all supplemental to the content that's already a part of the existing video and script for each of the educational encounters. And the nice thing, excuse me, about these handouts is that we make sure that we're infusing the universal design principles, but also thinking through how this handout can supplement the content and help a facilitator really work through supporting the participants within the program to be able to create their individualized health goals and be successful at achieving them. The next slide is the back side of that meal plan that also shows the grocery list and how you can check that off and thinking through what that looks like when you're going through the grocery store as a supplement to that meal plan. The next one is our adaptive exercises. The educational encounter that probably I would say had the largest overhaul would be the exercise within reach. And a big component of that is thinking through the curriculum, offered one opportunity for exercise with the facilitator and the participants, knowing that a lot of different individuals might experience barriers to certain types of exercise or be uncomfortable or lack confidence and skill. So being able to give alternative options for adaptive exercises was really important for us as a part of this particular lesson. And so what you can see on the slide here is a simple PDF of exercise videos that we created with different self-advocates from across our state that have a variety of different limitations or disabilities, and showing different ways that anybody can do certain exercises. This is also included within the educational encounter PowerPoint as well, within videos. So we have on the next slide here is an example of our arm circle video. So thinking about, if you're familiar with the curriculum, the aerobic opportunity was jumping jacks for that circuit training. So for somebody who needs to be in a seating position that can't do jumping jacks, something as simple adaptation is doing arm circles. So this is an example of one of the video supplements that's a part of the educational encounter, showing different ways that individuals can still get their heart rate up and be active, excuse me, and learning how to move their body and getting comfortable with exercise in ways that work for them, as well as adding different ways of intensity. Thank you, Austin. And this is one of our other wonderful supplemental handouts that's also an activity that's included within the resources that we provided for Healthy for Life. This is the healthy ingredient swap activity, which we adapted to be a handout that you can see where you connect the ingredients that are on the left side and swapping them for the healthier option on the right side. But within the facilitator notes that Austin's going to explain here in a minute, we also gave an opportunity for this to be a virtual online activity in game that has the pictures in an interactive game that someone could access from their computer, their phone, or their tablet to also to be able to make those selections, to make those swaps from the left and the right side. And this one is our SMART Goals handout. This one is specifically we created in support of the SMART Goal activity from the Healthy for Life curriculum. This built upon our lived experience from a program that we did called Health Partners within our state that implemented SMART Goals as well. And what we learned from that 3-year project is that the best way to help people continue to write SMART Goals is that every time that we're doing a lesson, work through each steps of the SMART acronym to reach that goal based on whatever the topic is, if it's the exercise one we were just talking about or a particular nutrition message. And so this helps them think through identifying each one of those areas of what is SMART to make sure that their goal is written in that really attainable way that's going to help them be more successful. And so what we love about this one is that we were able to do that and keep that that structure, but also make it interactive for the participants as a handout that you can use as a facilitator to really support them in making their goal the best that it can be for their individualized needs. And then of course, I would say our cherry on top is our picture recipes. We did picture recipes for each of the educational encounters that we partnered with American Heart Association Airmark on for Healthy for Life. And so those are included there on the screen. And the next slide shows an example of one of those. So as you can see with the picture recipe, we're infusing the universal designs principles by having pictures of real images that you would have on a grocery shelf to be able to purchase, and whatever utensils you would need in the kitchen as well to complete that recipe. And then having the pictures of the steps, each step having the examples of how you prepare that particular step for the recipe and what is needed in more concise, broken up ways to digest how to do that. I don't know how many of you all sometimes go to do a recipe and you forget to read it all through first, right? And so when you get down to step 4 and you realize there's something you should have done on step 2, having it broken up in this universally designed way really helps with that digesting of that information and doing each thing step by step, especially when you're supporting individuals who may not be familiar or comfortable in the kitchen and just starting to learn how to use their kitchen and cooking skills. And so this has been probably one of the most popular of our resources that we have supplemented the Healthy for Life curriculum with, in second to the PowerPoints.
So with the mention of PowerPoints, we did create PowerPoints for 11 of the educational experiences. And so these in creating them, there is the slide version, and then there's also a facilitator version, which we will get to in a moment. But here's just a screenshot of one of the slide decks, or part of the slide deck we created for Eat a Rainbow. And as you can see, we infused images and the concept of plain language, or thinking about like what are the key messages in the script or in the lesson plan that would be important to have on a slide as like a visual cue or another way to present information. There's also videos and then screenshots of the various handouts that act as visual cues or prompts to let facilitators and participants know what handout we need to be looking at right now, or we're going to be talking through. And so wanting to make sure that we made this as accessible as possible, and thinking through that the lesson plan's already created, and we really wanted to stick to the existing lesson plans and the scripts that AHA has created. So what we did is in the facilitator notes, or the PowerPoint notes, we offered, or we embedded the script, and then we offered different visual cues to help facilitators know, how do I navigate these notes? So anything in quotation marks is something you would read. Anything that is bolded is an action you should take, or a facilitator should take. Italicized notes are suggestions on how you can make your session more accessible or inclusive. And then there's also links to supplemental and optional videos and resources, both for participants and facilitators if there's a conversation comes up or a question comes up, and just so you have easy at your fingertip access to more information. And so this is an example of one of the facilitator slide decks. And so as you can see, the bold would indicate that you would play the video. The blue is the link to that video. The italicized note is to ensure that closed captioning is on, because that would increase accessibility. And then just some general notes about what this video you're about to watch is going to be about, so the facilitator can be prepared. And then that, like I said, we did 11 PowerPoint presentations that will also include aspects of if you were to offer this in person, but also thought through some ways that you could adapt the activities to make them more interactive in a virtual setting. You're muted.
Yeah, I got it. Which was really timely because we first started our partnership prior to the pandemic. And so our first pilot was an in-person pilot where we piloted the first 4 of our educational encounters that we had started to infuse universal design strategies to. And when we did that evaluation, we did incorporate universal design into our evaluation materials. We did not change any of the questions. They were all the same from the Healthy for Life curriculum. What we did add were images for the questions themselves if they were talking about certain topics, as well as for the evaluation measures. So you can see there on the left-hand side, the emoticons to help someone understand if they are confident versus if they are confident. It just helps them be able to comprehend the question that's being asked and how to be able to answer that. We did that specifically for our audience because we offered an inclusive opportunity that had people with and without disabilities. And we want to make sure that we're making the evaluation component as broadly accessible as possible as well, because oftentimes individuals who have low literacy or cognitive disability are often omitted from evaluation components and research. And so this was a really important effort that we did with permission from American Heart Association and Aramark. In addition to that, we asked a couple of questions. On the right-hand side there of the slide, you can see that we wanted to know, those are our buckets as well, in addition to the emoticons about if something doesn't apply to you or if they always do it, is also to help cognitively for people to understand what's being asked and how to answer. And then the additional questions we asked were about the universal design resources and if they benefited the participants in helping them understand or increase their skills or their confidence level. And so we wanted to make sure we were capturing that what we intended to do was actually benefiting our target population. So for our first pilot in 2019, these are our in-person results. We had 22 individuals that completed the evaluation out of the 29 that participated in the program. And you can see that 16% of them increased their daily consumption from pre-workshop to post-workshop of their fruits. 5% increased their consumption of veggies and 13% for grains. I'll tell you, for Kentucky, that's pretty standard. We struggle with eating our veggies around here, but we were really happy with those results to see that we had some positive outcomes from our participants in being able to have a healthy behavior and outcomes from the program. For 2020, we did a virtual pilot in the response of COVID. And so with those results, we did everything. All of the educational encounters were done virtually, as well as with all of our evaluation and our follow-up. And some results from here are that our participants said they were confident in their ability to eat the recommended serving sizes of the foods they eat at 100%. And the other one over there, sorry, the chat box popped up over it, is that they were confident in their ability to substitute healthier cooking and preparation methods traditionally for fried foods at 70%, which is a really great outcome for the smaller number. We had 7 participants in our pilot results. We also asked them about their behavior outcomes. And so when purchasing food, I read the food label and checked the nutritional values at 70%. And then I use the list when I go grocery shopping at around 85%. So some really great positive outcomes from our virtual pilot. And then in compiling the results for both the in-person and virtual pilot and looking at the universal design results, we got 100% across the board about saying that they were able to do all of the activities, that they feel that the slides help them better understand the lessons, and feeling that they could prepare healthy meals at home using the picture recipes. So we feel very strongly, with a 100% of strongly agree, that the universal design resources that we've been able to create through this collaboration and share with you today have really benefited the participants, but then also speaking as a facilitator from being able to do the in-person pilot as well as the virtual pilot, being able to have those supplemental resources was also really helpful for me as a facilitator in supporting individuals who maybe really struggled with some of the content knowledge or not having the experience, being able to be in a kitchen and to be able to cook, having the visual cues and the way that we think through universal design and think through how somebody accesses the content and really works to be engaged in the lesson and the program. It was really helpful as a facilitator to support individuals to be successful, which is part of why we do what we do, right? Just to help community members out. So really grateful for the positive feedback that we got from our pilot.
So something that came out of a resource that came out of this collaboration, and more so our pilot, as the world transitioned to a virtual setting, we really wanted to make sure that our pilot was going to be inclusive and accessible as possible. And thinking about, there's all these wonderful resources about how to make a virtual meeting accessible, but thinking about all the different components that go into health promotion programming and thinking about, okay, how do we universally design a health promotion program? How do we engage participants when we can't physically be in the same space as them and make sure that they're getting to interact with the content? So out of that, we have this wonderful resource that was created. It's in the final stages of editing, so you all get a first shot view, but we created, in collaboration with New York's Disability and Health State Program, a resource on how to create accessible and inclusive virtual programs, events, meetings. And so we put all this concise, we wanted it to be concise information to really get people thinking about inclusion and accessibility in a virtual world, and making sure that it's something that, like, okay, this is something I need to be thinking about. So we created this game board that has responsive design and is interactive, and you click on each space and it will provide you with additional information about what you need to be thinking about when you are designing or creating or offering a virtual event or program. In addition to the responsive design of the modals, when you click on the spaces, we also wanted to make sure that we were providing individuals with external resources that we know are going to be more comprehensive and really get to the nuts and bolts about what universal design is, or what plain language is, or one thing that we really enjoyed about the virtual setting is we learned about all these new cool virtual online gaming activity sites. So we just wanted to provide some ways that like health promotion educators or professionals can think about, how can I engage with my participants if I can't be physically in the same space with them doing an in-person activity. And so just going down, it provides just, general information. And then it also provides more of those overarching resources about inclusion, accessibility, and planning and organizing virtual or accessible and inclusive events. Lindsay, I don't know if you want to add anything.
Yeah. I think it's important to mention that when we created this resource, the reason behind it is because there were so many resources that what Austin just shared as the external resources that were created that focused more so on how to make accessible meetings, and two were maybe 40-page documents about how to do so. And so as a program planner, I know that having a program that is fun and interactive and also accessible and inclusive is a lot more than just making sure that my meeting platform is accessible to individuals who might have some barriers to accessing it. And so we learned that as well as we were working to do the program planning for our virtual pilot for the Healthy for Life program. And we were able to harvest a lot of great information from the existing resources that focus more so on meetings, but then use our lived experience and in talking with other partners that were working on promoting health programs virtually to be able to create this resource with that specific lens in mind, and thinking about how do we really process and accommodate what we need to do in the planning process, which is the first part of the entire game board before you even get to go time, and thinking about how we're engaging with participants and making sure that we're doing that in a successful and inclusive way. So I think that that's a really important thing to know about this particular resource that came out as a wonderful addition to our collaboration with Aramark and Healthy for Life with American Heart Association.
And then one other resource I want to highlight, and this is a resource that is included in the PowerPoints and facilitator notes, is an adaptive kitchen equipment resource that highlights different tools and utensils and devices that can be a support to people who are either, have a disability, or they're just not comfortable and they're getting familiar with cooking in a kitchen. And so thinking about the safety component. And so there's different things like different cutting devices, but also different ways for different technology. I say technology, but it's very like low grade technology because it's nothing there's the electronic can openers and stuff, but also like something as simple as finger guards for cutting, with the chopped salad competition, there is a lot of knife cutting in that. And, one thing we were thinking about is, okay, if this is a virtually offered session and you can't be there to support someone who is, not familiar with knives, but you want them to engage, is there some tools we can provide or suggest that would be helpful? So there's the finger guards, but there's also a lettuce knife that is not as sharp as a regular knife, but still gets the job done, or a rocker knife. So just thinking through different ways that you can support people and individuals to learn and get more comfortable with cooking and leading healthy lives. Where are you? Oh, there we are.
Yeah. So we want to be somebody that you all consider as a resource and a tool. We want to share our lessons learned and our best practices. And we, again, are super excited about this opportunity, and we're grateful for the resources we've been able to develop in partnership with that. Our handle is wellness, the number 4KY, and we are at uky.edu. Our website at the wellnessforky.org houses a lot of additional resources that we've created with other partners within our state and even with other national partners. We have a Facebook page and then a health and wellness YouTube channel, which has all of those adaptive exercise videos that I was showing, in addition to some other wonderful resources. We have a very charismatic, wonderful staff member named Morgan, who has Morgan's Musings videos, where he is a self-advocate, interviews other health professionals or professionals in the field or self-advocates talking about how they stay healthy in ways that they can be good leadership skills and advocacy. And so we got a lot of fun, great things on our web, and we really just want to continue to support the great work that you do in the community and look forward to you all being able to put these resources to use, because we've worked really, really hard on them and we're proud of them and we're excited about them. Yeah, so we're grateful to have you with us today, to have you all be able to access that. And I think we're going to turn it back over to Heather so she can show you all where on the Facilitator Hub you can access these resources and ways that you can put them into practice.
Great. Thank you so much, Lindsay and Austin. As you probably could tell, not only did we, work with the team at the University of Kentucky Human Development Institute, but certainly they are able to share some additional tools and resources with all of you, because certainly they have been leading some of this work independently of the work that they have in place with the American Heart Association and with Airmark. So I know I have been getting lots of questions on where are these materials, where can I find them? So first and foremost, if you're not already registered to access our Healthy Facilitator Hub, I would just ask you to just go ahead and complete the quick registration form, which is located at heart.org/healthy4life. And when you do that, this particular website will certainly automatically show up and you'll get an automated email. You'll notice way at the bottom, it's not because it's not important, it's just the way our website is designed. We now will have a listing for the Universal Design resources that Austin and Lindsay mentioned. This will take you to its own independent web page where all those handouts and recipes are housed. So they are organized by the type of document. So the handouts are there listed first, followed by the recipes, and then the PowerPoint training materials. As Austin mentioned, each of the PowerPoints, you'll notice that there's two different formats. One is that's the PDF presentation itself. That's something that you would use when you're sharing this with others. And then certainly the presentation that has the presenter notes. So certainly you can download both of those. The web links or hyperlinks, I should say, are active. So if it's linking to a video or if it's linking to another resource, it'll directly have that embedded within that PDF. So I know just from my experience over the years, one of the resources that was indicated that was a need was in fact PowerPoint, resources to go, to align back with some of the educational experiences. So we do hope that this is an additional resource that you can certainly utilize. And particularly now, just given the fact that we are perhaps limited in our ability to be in person, certainly the use of a PowerPoint in an interactive way can certainly be used virtually through, in a number of different ways. So somebody had asked about how we plan to communicate these new resources, not only to Healthy for Life, but other stakeholders. So just keep in mind, we are in the process of really building out our full communications plan on how best to share these new resources. Certainly the existing individuals that are registered for the Healthy for Life Facilitator Hub, they do receive a monthly email, and one of our future emails will in fact highlight these new resources. We will also be working through external stakeholders and sort of partner organizations in terms of making sure that these types of resources are really being shared with organizations where they could certainly be an added resource. So whether it's state health departments, cooperative extension, those are just two specific examples. So we do have some time for Q&A. I noticed that there were some in the Q&A. So one of the questions was whether or not, how are you able to do this virtually? So I don't know if Lindsay or Austin, you guys would want to share anything above and beyond what you've already shared. I can certainly mention that we have identified some specific educational experiences that may be more adaptable to offer virtually. And in fact, we do now have a very brief facilitator guide if you're going to offer this virtually. So I will certainly put that guide in the chat function so everybody can access that.
Thank you, Heather. And thinking about our pilot and how we were able to offer it virtually really came down to Lindsay has a lot of experience with health promotion. And so thinking about, okay, we're now in this virtual setting and we do want it to be interactive is one of the things that I thought was really great is we were still able to do the recipe preparations, and we mailed or did Kroger click lists. That was just the grocery store that was most convenient in Kentucky. It might be a totally different grocery store. We don't endorse Kroger is the point I'm trying to make, is that we were able to organize and coordinate this so that people could get the ingredients and either follow along during the actual session or prepare the recipe after the various sessions so that they could get that more interactive experience. But then also thinking through some of the other activities, I know one in particular that we were really struggling to think, how do we adapt this to offer this and make it a virtual interactive experience, was the Smart Fearless Shopper. That is an experience that you either go to a grocery store or you set up a mock grocery store and then the participants interact with that setup. But that wasn't going to be a possibility doing virtual. So our team came up with the idea to, create some slides that helped create that, that helped kind of set up the grocery store based on AHA's curriculum and existing handouts, but then also in thinking through, okay, maybe we can't go to the grocery store, but we can have a picture or a setup of a grocery store that the facilitator and the participants can talk through. And then with the weekly meal plan activity is actually pulling up an ad for a local grocery store in your area and talking or working with your participants to create a weekly meal plan based off the local sales and the local food items and what's in season. And Lindsay might have more to share about how we did this virtually.
Yeah. So I think the first thing would be what platform, which is a part of the live resource, the Game of Live resource that Austin shared, is one of the first parts on the game board, is thinking about which way, how are we going to offer it virtually. And so we were able to use Zoom, which is what we're on today, but knowing that there are other platforms, some that might be free and not cost a subscription service. So thinking through what kind of platform that would be most accessible to your participants. I know we've also supported other nutrition agents across the state that do Facebook Live and Google Hangout Live as an opportunity to be able to have participants be able to do their virtual programming. And so once we were able to set that up and have our participant group, and honestly offering it virtually allowed us to broaden our pilot across the state. And one of our participants tested positive for COVID during the program and didn't miss a day. She still came and was still able to participate and be a part of the class sessions, which was really incredible, which would obviously not have happened if we were not in that virtual format. And so really following up to what Austin is saying, if you look at the facilitator notes as a part of the PowerPoint PDF, you'll see where we specifically give instructions and ideas about ways to have inclusive opportunities, especially thinking through that virtual platform and ways that we can make that happen. So I know Austin gave some really great examples. One of the other ones that we really enjoy to use a lot is Jamboard, which is a free service. And you can use that as a part of your screen share and have that be an interactive opportunity where the link is shared with all the participants, but they can all interact on the same screen by adding comments or pictures or text. in different ways. And so their draw, even we've had participants draw and be a part of our activity. It's called Healthy Harry and Unhealthy Eugene, which is one of our supplemental activities included. So I think if you get a chance to look through the facilitator notes, you really see that that was a strong effort that we made to think through your role as a facilitator and how to try to support you in providing that fun and inclusive atmosphere in that virtual setting.
Great. Thank you. And then one of the other questions is whether or not, the U.S. Dietary Guidelines that came out at the end of December, so representing sort of the guidelines between 2020 and 2025, were there any adjustments or kind of, were they considered as part of that review process? And so certainly from the science of the American Heart Association, we certainly look closely at the U.S. Dietary Guidelines in comparison to the AHA's healthy lifestyle and diet recommendations. So those were certainly reviewed as part of this, the development process of these new resources.
So I just saw something come through the chat about, did you share the handouts electronically or mail them to the participants ahead of the workshop? We did both. So in coordinating the click list, we also wanted to make sure that people had access to the handouts to engage with them. So we emailed them, and a majority of them we mailed, but the slideshows we did not share with them because those were still going through all of the testing, and we wanted to make sure everything that was going to be shared in the world as far as the PowerPoints was finalized. But yes, we did share them both electronically and in person, or mailed them.
And to think when we didn't have the power, that everything was finalized, so it was important for us to make sure that we shared it with participants in the formats that we could, so electronically as well as in the physical format, especially thinking through that SMART goal handout where they can write it out themselves. And so we were fortunate to have built in a little bit of a shipping budget and a postage budget to be able to afford having that, which is not necessarily something we would think of on the front end. So we're grateful that we had that. And then Bernice is asking about funding for supporting this. Our Kentucky Inclusive Health Collaborative at the University of Kentucky's Human Development Institute is funded by the CDC Disability and Health Program. And so that is what started our partnership with Aramark and American Heart Association. And then we applied for one of their small, Heather, maybe help me out there. It was a community grant.
It was a community grant.
Yes.
That was offered back in 2018
yes.
To 2019. And that's really where they initially got exposed and introduced to the Healthy for Life Community Nutrition Program and its resources. So from that initial year of implementation, we just continued our conversations, and I then learned about the great work that was being led out of the Human Development Institute. And it was just an opportunity as we were looking at how best to expand some of our resources. And they, on the turn, had been, utilizing them and certainly have that expertise for universal design. So it just sort of lended itself for a good collaboration. Well, I do want to be respectful of time today, and it's been great just to be able to showcase these new resources. We do appreciate everybody taking the time. We do have some closing comments here. One, I just wanted to make sure that you were all aware that we do have some other ways of connecting with the team at Healthy for Life. One is at early January, we just launched our private group for Healthy for Life facilitators. So certainly if this is something that you're interested in, it is another way of kind of sharing ideas, asking questions. We've also teamed up with another nonprofit organization called AMAVA, which is a volunteer organization. And we are hosting some what they call AMAVA Circle conversations. So we do have two that are coming up in April. Again, if you're involved, particularly in SNAP education, and you're able to join us on April 28th, you'll get the link in case you're interested in signing up. And then lastly, certainly share Healthy for Life as a resource with others, whether it's, through your social connections, through your professional connections. We are going to be hosting a webinar on January 17th at 1 p.m. Central. Again, this is really going to be sort of nuts and bolts on how to get started and what are those critical resources to really think through if you're looking at sharing these resources in your own respective community. So you again will receive that link as a follow-up to today's webinar. And so with that, again, really just want to thank everybody for joining us today. Again, the recording and a copy of the presentation will be sent out to the participants today, and then the recording will be housed on the Healthy for Life Facilitator Hub. If you do have any other questions or comments, certainly feel free to reach out to healthyforlife@heart.org. And again, enjoy the rest of your day, and we appreciate your time.
Thank you.
Thank you so much.